Hi, everyone. Thanks for joining me today. Today, we're going to be talking about the chart window here. We're going to be reviewing this screen. So we'll go ahead and take a look. Let's start, down over here on the right-hand side with our quick pick buttons. So in my previous webinar, we talked about where to set these as a default and how to go ahead and attach these other service codes in the drop-down menu. So we do have 22 of these quick pick buttons here. And we have two condition buttons, okay? We have a condition list. So this is going to list all of our conditions. Now, if there is something you like to chart that isn't in your condition list, you can add a new condition as well. So you would type in the description and then what kind of abbreviation. So the abbreviation would show up if you wanted to make this particular one a main button. This is what the abbreviation looks like here. So whatever you want to show up in that actual window. And then if you want to give it a drawing, now the drawings are going to be a whole nother webinar because you can create custom draw types. A draw type is how it draws on your odontogram, okay? So this is a draw type for core, right? So if you wanted to do a draw type, you could attach a draw type as well. And a color. Now the action code, you'll want to take a look at too, because this is going to help it draw as well, okay? If it's a condition that would in fact create a missing tooth, you'd want to click that draw type so that the system knows to remove the tooth from that odontogram, should that be the case. And then button group here. So if you want this condition to go under button group 1, which would be here, or button group 2. Also, what area does this condition affect? Is it just the tooth in general? Is it a surface? So if you're adding something like, a chipped condition, you'd probably want a surface or the root. So you can do that as well. And what I like here is they do give you those two condition buttons so that you can make your most common conditions your main buttons for ease of charting. So I know when I have a new patient come in, the first thing I do is, chart missing teeth. So I simply select, the missing teeth, and then I click on this button here. For me, that's a common condition. I don't have to go dropping down and searching for that condition. Decay is also a pretty common condition, but you can make these main buttons whatever condition you'd like. The nice thing too about missing teeth, if you're looking at your molars, if you right click, you can hide that missing tooth. It's only on the molars though. For some reason, we don't get that option for the other teeth. So you can hide them. I think, molars maybe are common missing teeth. We know wisdom teeth are common missing teeth. So it is nice to kind of have them not show. Again, you have your list of conditions. We also have a list of services. So we have our service code list here. We know we can search by service code, ADA code, description, or service type. I always make sure I have this auto search box checked so that it starts searching on each character I enter. We know at the top, we have placed periods in front of our exploding codes. So those are easy to find and access. So again, the goal of these quick pick buttons is to have your most common codes right there ready for you. Your drop down has additional codes that relate to that main code. We still, we realize that sometimes you may get a new patient in that just has something in their mouth you've never seen before, or that isn't very common. So you can always access that service code list there to chart if needed. Permanent versus primary. So if I select all and I have a child, I can select primary, and it's a primary dentition. Now we can always create that mixed dentition. So patient comes in, they're starting to get their 6-year molars. I simply click where their molars are coming in, hit permanent. Now we have our permanent molars. Now, of course, these are showing with restorations on them because this is an adult patient. But just for example, I'm just showing you, if we select all, hit permanent, we get all of our permanent teeth. We know occasionally we get that adult that has that retained deciduous tooth, so we could always just highlight that area and select primary, right? So these buttons are great. We can select all. We can just select all upper, all lower. So, I know clear all upper left. So when we're proposing maybe SRPs, we can do it by quadrants. So that's what those are. Insurance. So if the front desk, this is where you can get your insurance information for the patient. You can also get the front desk when they're entering in the notes, like say the frequencies that the patient, can have x-rays, fluoride, cleanings. If they enter that in the notes, you'll be able to see that here. So there'll be no need to go, bug the front desk of, hey, can my patient have, fluoride? Hey, are they every 6 months or, twice a year? So it's nice to have that information in there if that has been entered by whomever is entering that insurance information. Images, so you'll see the images here on the left-hand side. If you are using SHIC, now that does integrate right into Eaglesoft. I know Gendex does. There's a couple other sensors that do. Dexis does now. This is a brand new newsflash. So Dexis will integrate right into our advanced imaging. So you can see the images on the left. Now, sometimes if there's a lot of images and you open up this chart, it could take a minute for this to load. So you can always turn that off there on that right-hand side. Once your chart is loaded, you can click it back on. You can zoom in on your chart here if you want, if there's a reason. Just keep in mind, it is kind of hard to see the little lip down there on the bottom to close that back out. This red cross is going to be your medical alert. So if you close that out when you first opened your chart and you want to see it again, you can just simply click that. If you want to see that patient's photo, there you go. You also have this tally on the right-hand side that's showing you when your last x-rays were completed. I want to show you this ledger button. So you can hide the ledger if you want. So if you have a patient that you want to turn around in the chair to look at the chart, I would recommend hiding that ledger. Why? Because it shows money. So we know when patients see money, they tend to shut down and stop listening to anything we have to say. So it's a good idea to go ahead and switch that off. This fast walkout, this really is going to take all your services for the day and submit them straight to insurance. So it's really, truly bypassing the front desk. I don't recommend a lot of offices do this. This is where a lot of mistakes can happen. But I know there's some offices that do. The back will, go ahead. They'll take payment, they'll walk out services and submit the claim. That's what this does. I usually recommend people stay away from this button. But again, that's entirely up to your team. We can take a look down here on the bottom. This legend is showing you all your draw types. So if you see a drawing on there and you're not sure what it is, you can take a look at that legend. Of course, you are able to look at the ledger to see exactly what's charted as well. So if you're not sure what's proposed on number 15, if you just look under tooth here, you can see, everything that's been proposed. And if you right click as well, you look at the history, you'll be able to see, exactly what has been proposed or charted as well. You can print the chart. If you're going to print it, I do recommend hiding the ledger. That didn't hide. That is actually set in our preferences. Sorry about that. That is set in our preferences. So if we want to go ahead and cancel out of here, practice management, file preferences, we'll go back to our chart, print ledger with chart. So it's up to you. You can print that ledger if you'd like, or you can simply uncheck it. And we'll go back to our chart. You can filter what you're seeing. So if you show what, and you only want to see proposed, you can certainly filter out what you see. Actually, I didn't do that correctly. That's on the top. Let's uncheck these here. So sometimes we know there's patients who have a lot going on, who've had a lot of dental work. Maybe we just want to see our proposed, right? So you can certainly filter that out. We can also include perio items as well. So you can set that as a default in your charting preferences, or you can do it here. So say I just want to see pocket depth. So when we look at these little bar graphs, it's showing me the green and the red, right? So green is good, red is, hey, we have a problem. And we'll go over that with our perio chart as well. There is a graph you can print for the patient as well. But you can default your chart to show these automatically if you want. And that's in the file preferences in your charting tab. I tend to think it's a little busy, but again, that's total personal preference. Okay, coverage book. This is just more insurance information. If they have a coverage book and you want to see it from the back. Treatment plan, we will go over how to create a treatment plan. Delete, so this delete and edit, this is going to be for your ledger. So if there's something that you charted accidentally, you could simply click it and delete it. If it's something that you need to maybe modify the services or the surfaces, excuse me, if you click edit here, you can certainly do that. You can also right click up here again and hit that edit and modify that from there. So a couple different ways you can do that. And then when we take a look here, this is our status menu, our drop-down menu. So this is when you're charting, you're going to make sure you're charting the correct status. So we know when we have a new patient come in, what do we typically do? We'll chart existing work first. So once we have that existing checked here, we can go in and say number 6 has a composite. We click this composite anterior, it has an MID composite, right? So we have an existing composite. So we'll go ahead, we'll chart all of our existing. Poor Charles Abbott, I hate adding more work to him, but say he has number 26 has a root canal, previous root canal, right? Now, once doctor comes in and does the exam, we're going to switch this down here to proposed. And we'll just say this tooth is starting to get gray. We need to go ahead and we're going to do a nice ceramic crown here. I'm going to go to my drop down here. I'm going to click 2740. So say for some reason I forget to change that down here to propose and it's still on existing, it would look just like this. I could go ahead up here and change it as well. This remarks for unusual services. If you think you need to add a narrative, this will show up on the insurance claim here. If you have narratives already created in your system, right, you can go ahead and add it here. I'm going to hit OK. And this does show you the provider. It's showing you the fee. You can change the fee from here if it's something you want to do. So now I have my ceramic crown proposed. Okay. We also have referred. So we'll just say we need to refer number 32. I'm going to right click here. Whoa, number 32 has had a root amputation. Woo! Well, let's just say it needs to be extracted. So we're going to go ahead and refer that for extraction. I have this on referred, and I'm going to click extract. And now we have an orange X. So that means it is referred out for treatment. So now we can see when we right click on that history, we can see that we did refer that out for an extraction. We can also see it here. And then we have rejected as well. So if this patient says, I understand my tooth is chipped, however, I just don't have the money for that crown right now. Can we just patch it, right? So you propose, say you propose, you know, very large filling. So we're going to do a large filling and really try to just patch that for now. What we would do is when I go in here to edit and I get to my crown, I could come over here and I could hit rejected. And that way, when you look at that tooth, if I can click off of here, now we see this kind of yucky brown. If I'm going to bring this to the top, we can see, right, that crown was rejected. I'm going to go ahead and bring that proposed filling to the top. You're going to see the proposed filling, but you're also going to see some of that rejected color as well. And you can also see that here in the ledger. So it doesn't remove it, you know, from the chart or from the treatment plan. It just shows that you did propose that at one time and the patient rejected it. We're going to go ahead and take a look at these drop down. These are called integration buttons here. So the one on the left hand side is going to be our notes. So our note history. This is where we're going to go ahead and write our clinical notes. Okay. And we also have a patient memo. This patient memo is excellent. This is probably the one thing in Eaglesoft that if you delete it, it is gone. There's no trace of it. So the patient memo is more for little, you know, maybe personal notes. A patient, patient pregnant, patient going to Disney, you know, patient getting married, loves to play soccer. Patient brought us donuts. Now it doesn't time or date stamp it. So that's something you would want to enter in there. Just so you know, you can kind of keep track of things. So you would want to enter a date in there. You could also enter your initials. It doesn't keep track of any of that. So if you look down here on the bottom, you'll see this notepad is blank. Once you start typing something in here and you hit OK, you now see there's little scribbles on here. So you know that, hey, there's something written on that memo. Maybe I'll check it out. Once you delete it, it's back to a blank notepad. So these icons show up here. So whatever you use last is going to be the icon that remains there. And we're going to go ahead and get into the auto notes in our next session. The middle drop-down integration menu is going to contain a lot of administrative things here. but it also has your lab tracking. You can prescribe from here. So if you have your templates created, if you have your drugs entered, your pharmacies entered, it's very easy to print out a prescription from here. Now, this isn't e-prescription, so this, these aren't emailed. We do have an e-service called e-prescriptions that you can subscribe to that would do that for you. But this, we typically print these out in the office, or you can call them in. So you can prescribe. You can also see the prescription history. We don't have any for Charles, but the prescription history is going to show you, anything that was ever prescribed. And then you could also do a refill from here as well. We can also get to a treatment plan from here and from here. And there's an icon on the schedule typically too. So different ways to get to that. Sorry, I had to pause the video. The beauty from working from home, the little guy coming in and out. You can also access the patient Smart Doc from here as well. Okay, and we'll talk about Smart Doc in another video. And on the right-hand side is going to be your clinical items here. So you can get to the perio chart from here, the clinical exam, right? Your imaging, your medical history. If you need to go to a different patient, you can change to a different patient. You can also get to your edit patient screen from here as well. Now, your edit patient screen, one thing I really would like to point out for, all the hygienists out there, in the preferences portion of your edit patient screen, you're going to have your recall frequency and your preferred hygienist. So if you have a patient, always, wants to be scheduled with you, I would change that here. And if someone is, a 4-month or a 3-month recall, I would change that here as well. If you don't, your recall reports will be inaccurate. You'll be calling someone, in 6 months versus trying to get them in 3. So you could very well miss one of their recalls. So I always make sure to keep this updated as well. We're also here. This is where you would check mark if they are pre-med. If they are pre-med, you'll get a pill icon on your screen. And you can also see here their tally of failed, canceled, or neither appointments. If they have appointment time preferences, or if they can come in on short notice, right? This prescription template, so if they're, pre-med, you can always make this their default prescription template if you'd like, or Valium. Whatever the patient typically needs from you, you can attach it there. Also, if there's a preferred dentist, you would want to make sure that's correct. We'll go ahead and close out of here. So these are our main drop-down integration buttons. We'll move on to the perio chart here. So if I click perio chart, remember we had that setting in the preferences to show previous perio chart when opening new perio chart. So our previous information populates here. This is nice if perhaps maybe there's just a couple of changes. You're going to do a new exam today. You could just hit new exam and just, kind of select where those few changes are and make those few changes, right? And once you save it, it's going to save as a new exam. So we have probing depth, which typically is the default starting measurement here. You have your gingival margin. Your clinical attachment level will automatically calculate based on your probing depth and your gingival margin. You can chart your mucogingival junction, mobility, and furcation. So these can all be charted. So it defaults, let's just click new exam here. And I'm going to do a brand new exam because let's just say there's a lot of changes. So I'm going to clear all. And I'm going to go ahead, enter my numbers. This is my path or my process that I selected for this workstation. You'll see there are 2 rows of numbers and you're wondering why. Well, remember I said it calculates your clinical attachment level. So if I go in here and enter, I'm going to switch to gingival margin. If there's 2 millimeters of recession on the direct buccal of number 2, once I enter that in, it changes that number. Say there's 1 millimeter here, 1 millimeter here. So you'll see how that process works. You want to chart your furcation, you simply click the FG and put in your numbers. Your mobility, that chart's on the top. So if I have a class 1, class 2, and then your mucogingival junction, you can, chart that as well. I know not a lot of people do that. I think maybe periodontists do that, but that is an option. You can chart bleeding. So if there's a lot of bleeding, you can hit the lock and you can simply just go ahead and select your bleeding areas. If there's bleeding everywhere profusely, I just click this all here or none. You can also chart separation, which is going to show up yellow. Again, if you lock it, you don't have to go back and click on it every time. If there's bleeding and separation, you see that it turns kind of to a mauve color there. Now, when you're charting, let's go back to probing depth. You see these numbers on the bottom? These are used for if you need to chart something 10 millimeters or higher. This is what you're really going to use these numbers for. So say on the mesial of 16, I have a 10. I'm going to click this 10 and then a 0. So now I have an underlined 0. That means it's a 10 millimeter. Say the direct is an 11. I click the 10 and the 1. So now I have an underlined 1 and so on and so forth. So that's how you would chart anything 10 or higher. We can save this exam. I can compare up to 3 different exams. So you can see if I hit show, I can pick, let's remove one here. I can pick which exams I would like to compare. I've done a couple of exams here today. So if I hit OK, I'll get those comparisons here. I can see a perio graph, right? So it's showing me my probing depth, which is going to be the bars, my gingival margin, which is this blue line here, and my mucogingival junction, which is this bright green. You can also print this. It also shows you your bleeding and your separation, or both, okay? Now, as you can see, this implant here on this periograph, it does not show as an implant. It's just showing as a missing tooth. There is a workaround for that. If you did indeed need to see the implant on that, remember how I said you can superimpose the perio charting information on that odontogram? You could do that and it would show, and I'll show you that in 1 second, but you could print this for your patient. You can also look at a comparison graph. So each different exam will be a different color. So I'm going to hit show and let's see, I'm going to compare a couple of different exams here. I'm trying to get a good one here. You know, with this demo database, we don't really have the greatest, most accurate information that you would typically have in your normal day-to-day practice. There we go. So you'll see the different colors, which signifies, you know, your different years. So you can print that as well. So when we go back to your perio chart, your process, so remember how in the preferences, I said we could set our preferences per workstation. If for some reason you have to jump into another room and their process isn't the same as yours, you can just simply go to this drop down this one time and switch it. And then you have your integration buttons back down here. And again, you have your last radiograph information as well. So let's take a look, see how we have our implant here. If I wanted to go ahead and take a look at our perio items, I'm just going to look at the pocket depth. Then we could see those lines, those bars, and see that it is indeed an implant. And you could print this as well. So that is a little workaround for that. So that really is your charting module in a nutshell here, and your perio. We're going to get to treatment planning and the other notes in our next video. Thanks for checking it out.